Hey everyone, welcome back to my channel. And no, things have escalated for for Grace. No, not a nurse. She is not a nurse. For Grace MG. And I found some screenshots. We're going to go through them one by one. I found a couple of videos and then a final escalation as of yesterday, Philippine time. Because right now it's 7 o'clock in the evening here in Canada. Minus 12 hours. Yeah, it's already 7 a.m. there in the Philippines. I guess that's a time difference. Anyway, before I begin, just a reminder for for a disclaimer for this video. Please do not harass or you know don't harass anyone on this video. Everything is taken from public post, but it doesn't mean that it gives you the right to look for those people and then send them messages if you are a friend or foe of the people involved in this video. Okay, let us keep everything civil. This is only for discussion purposes. It's not meant to be used for evidence or anything else other than its purpose, which is entertainment and discussion only. Now let us begin. There we go. Okay. So Grace MG is called a caregiver in the Philippines, and I've actually found a different type of profession that they call OS. And I was wondering what the heck is an OS? And then I found it in the Facebook pages. Apparently it is an old sitter. OLD, old sitter. I was thinking like, why can't you use like old sitter seems to be a bit awkward for me. Like, why not elderly sitter? ES, elderly sitter. No, wait. No, you can't use ES. It's gonna be bad if somebody might think you work for a salon, spa, or massage parlor or something. If you know what ES means, keep quiet or post it in the comment section. Anyway, so here she is. Here is Grace. She is performing one of the procedures that could be easily delegated by the nurse to a caregiver. It actually shows up in NCLEX. Can you delegate this procedure to the caregiver? It's actually a yes or no question. If the patient is stable and you are not asking, you are not assessing why the patient is on a catheter, then you can delegate it to the caregiver. The times wherein you can't delegate as a nurse, registered nurse, you can't delegate to a caregiver is when there's strict INO for the patient. If the patient has kidney problems and you need to make sure to assess the quality of the urine, you also can't delegate this to the caregiver if the patient is freshly post-op, like within 24 hours post-op. Like, it depends on the protocol of the hospital, but generally speaking, if the patient is post-op or ICU or something else, this could be a task that cannot be delegated to a caregiver. But in this case, this is an elderly client who's possibly on end of daycare and like not really end of life, but yeah, elderly care. So I guess having this is quite normal, and the urine looks normal anyway. So she's doing the procedure. Okay, but the funny thing is, here in Canada we don't use dextrose bottles like this, because the IV bags that we have here are literally bags. You can't cut them like this and use it as on an all-purpose container, and it's fine. As a caregiver, she's doing stuff like this and it's fine. But she has been doing several things that I can say is a little bit sus or controversial. Here is one of them. So she is doing suctioning. She is replying to a comment on top of here. And the comment says, I'm afraid of your suctioning. That's a size 3 trach cannula that you push into the patient, into the trach of the patient, and It's not every time that you do deep suctioning, and that is true. Deep suctioning is a highly invasive procedure. It requires a doctor's order. It requires an experienced nurse to do it. And so I think it was a nurse that says this one. So you may have hit the lungs of the patient. In my 30 years of work, I never post something like this, and she is right. There is a lot of how do I say this? Here, even here in abroad, healthcare workers are under fire for posting something in social media. In fact, one doctor lost her license because she was posting too much on TikTok. And the funny thing is, in her videos in TikTok, she did not post the faces of her patients. She was doing the procedure. You can barely see the skin of the patient. So unfortunately, one of the patient was able to identify herself on that patch of skin or whatever it was, maybe the timing of the post. But whatever it was, this patient started to complain. She found other patients of this doctor who they then made a class action lawsuit, and this surgeon, this doctor, I think it was a plastic surgeon, lost her license, all because she could not stop posting everything on TikTok. So Grace replies, even if you have 20 years experience, if you do not deep suction your patient, you may end up killing your patient. And I'm not going to do this without the orders of the doctor. But here's the thing, you are not a nurse for you to do this. Even if the doctor orders it, you are not supposed to do this. You are supposed to call your nurse to do this procedure. And like I said, she is not even a nurse for her to insult the one that commented about 13 years experience. She's saying that even if you have 20 years, if you don't deep suction the patient, you will kill your patient. And she's saying that even if I did a deep suction, I have never made my patient bleed. In 2 years and counting, I have never made my patient, I have never had a problem with my patient. In fact, I made my patient stronger. Even if I'm very strict and highly irritable to my patient, and then the comment got cut off already. Now, here's the thing with the deep suction. You have to know how many seconds you have to do it. And it is right that you do not do it every time because it is a highly invasive procedure. In fact, you actually have to hyperventilate the patient first before you do the procedure, because you are gonna cause a hypoxic event for the patient if you do not know what you are doing, right? So you also need to know how long you can push it. I sincerely hope she's not doing also like an irrigation of the trachea. That's going to be a bit scary if she doesn't know how to do it. Injuring the lungs could cause bronchial inflammation, and which leads to like more problems for the respiratory system of the client. So yeah, you are not a nurse to be able to do stuff like this. That this is not right, right? So we have another picture over here. Now, she is saying that the patient has Pseudomonas infection. And I think I saw this video. She only had a face mask on and a pair of clean gloves, I think. But she is not in her proper PPE. Well, it may depend on a hospital per hospital basis. But if there's like contact precautions, you have to follow the contact precautions. For somebody with Pseudomonas infection, is a contact precautions. And she's saying here, resistant to all antibiotics. May last bala pa di pa din matalo ang bacteria. So even with the last resort, the bacteria can't be defeated. What can I do? And my patient is going strong, but the creatinine is also increasing. But the patient is also a fighter, so keep on fighting. And this is because you are swearing at Jesus. So she's doing a lot of things wrong here. One, she is not in proper PPE. Two, she is divulging the status of the patient. And three, she is divulging what the patient is doing and posting it on social media. Mhm. So hiring pa din kahit nasa hospital. So she's saying here, so it's still, we're still hiring even if I'm in the hospital. I don't know. Like, I'm not sure what the context of this screenshot is, but I'm looking at it. My main concern is she's not following a proper protocol for contact precautions. Next, this is a procedure. I think I covered this in my previous video. She is doing an irrigation of the Foley catheter, and she's using an acetic acid irrigating solution. But this is not usually commonly done unless if you it was ordered by the doctor and you know the reason why it is being done. And so the person here is asking, "Hi, ma'am, what solution are you using to flush? Is it sterile water or plain NSS or NSS irrigating?" And that's the thing. Even here in Canada, we don't use acetic acid for the flushing. We only use normal saline solution. So I don't know why she's using it here, and she's even making a claim here. It's an irrigation. It is mixed with 5 ml of white vinegar. Yes, you heard it. You heard it right. It is mixed with white vinegar. It is the doctor who mixed it in the hospital. And I have not heard that kind of thing. Even when we were making Dakin solution, a doctor never mixed the Dakin solution. So I don't know if she's lying about this or somebody handed her the solution. This disregards the 12 hours of the patient. So the commenter further asks, is it 1 liter of irrigation plus 5 ml? Is that right? Unfortunately, the post got cut off, so I don't know the answer for that one. So again, she's not supposed to be doing an irrigation. It is a controlled act meant for nurses. I have never heard of caregivers doing this. So yeah. And next we have here another video here. Then one of the posters is asking, "Why are you there?" And Christina Mendoza is asking, tagging Tesda. But Grace replies, "They need somebody that knows IV." And I'm assuming somebody that knows how to give IV medications. Again, she is not a nurse to be giving anything via IV. Wow. Okay, now this one, I also tackled it in the previous video. I'm not gonna do translation side by side translation for this one. Basically, this person is saying that nurses are complaining because they have to do 4 years of studying to be able to do what a caregiver does now, and they only need to do 8 to 9 months. And their level of knowledge is the same as that of a registered nurse. Now, this is a very dangerous mindset because we are not just like, I'm not gonna come here and say like I'm doing 4 years of nursing, but I'm able to do what a doctor does. That is not good. I know my limits as a nurse, and it will never be the same as a doctor. In the same way, a doctor can do stuff, but they can't do what a nurse does. Because we are allied health, we work hand in hand. So this statement here, they're basically saying they are as good as a registered nurse, even though they're only doing 8 to 9 months of studying. This is not good. And now we have somebody here saying, so she is fighting with a person named MJ, and maybe MJ commented on something. So she's saying here, what MJ says is, "You are very prideful. You belittle your fellow caregivers, and you have been very prideful, and you wait for your karma." And so she says, we are gonna leave you alone because of your attitude. and you are conceited and prideful, you haven't even reached half of your success. So yeah, this person saying that you are also using your patient for content, and that will come up in a few minutes. I'm going to show you why it's so bad. Now in my previous video, she actually posted her patient basically naked on the bed. Yeah, she covered the face of the patient, but like the whole body was basically naked. And the only thing that saved the dignity of the patient, or at least saved a bit of the dignity of the patient, is that um, the video was on the side. So you could not see the full frontal of the patient, but the patient was basically naked with no underwear uh, on the patient, like only a piece of clothing on top of the private parts. And even then, it was removed several times. And thankfully, again, the video was on the side of the patient, so you could not see anything. But it was very clear that the privacy of the patient was flawed, was destroyed, right? Okay, we finally have one comment here. So there's a lot of consequences of what you did, and you're not even a certified caregiver, and you have the audacity of belittling your fellow caregivers, and you're also belittling your other nurses. That's why you have to deactivate your account because of the possible. Did you deactivate your account because of the possible cases that you will be facing? Which is kind of true, I guess. And then we have, with regards to the situation where if she is certified or not, Grace is actually insulting the TESDA officials, saying here, the officers of the TESDA, not all but some, could you dress up properly? Because the ones that are rating the people studying for the NC2 look like laborers in the market, wet market. So see how prideful she is, that the people who give out the NC2 certifications, she is beneath her. That is the gist of what I'm looking here right now. And that's bad. And then this is an alleged comment. I am talking with my ma'am. Grace is going to be removed from work because of a lot of people are calling the administration, and I am one of them. My friend is, and the comment got cut off. And I have here a comment again, or a Facebook post by Nurse Nemo. Nurse Nemo is the one that really brought this up to light, and it has been posted several times by several nursing groups and influencers. So we have here Nurse Nemo actually sent an email to TESDA. So he says here, thanks for bringing this matter to our attention. Please be informed that based on our records, the individuals named Grace Pahe, Mary Grace J. Pahe, Michele Grace Pahe have no record or of having undergone training or passed the competency assessment in TESDA. Hence, they are not holders of the Caregiving National Certificate 2. Further, please be informed that the attached national certificate under the name Mary Grace J. Pahe is not authentic. So now we have a lot of problems. And one of the videos posted here is the one where she was giving an IV medication and the patient was in pain, and she did it a couple of times. So like lots of bad things. And yeah, let's see. One of the commenters is saying that maybe it's just teasing Grace, but apparently she has like a mental deficit or something. Let me take a look at more of the comments. Yeah, it says here, just my same deduction. Maybe the line is not patent anymore and move while the patient moved while the IV medication was introduced. And that was my general assessment. And that's the thing that I'm saying. The caregiver doesn't know the reason for that. Like maybe the IV catheter had extravasation or something infiltrated into the other tissues. Infiltrated into the other tissues, and That is something that we have nurses learn how to do, how to assess before giving IV medications. We actually have to test for the patency of the IV line first before giving any type of medication. Because if you remember, if the IV line is blocked, or worse, if the IV line has infiltrated into other tissue, giving a medication could be an irritant to the subcutaneous or to the intramuscular if that's where the catheter has infiltrated to. So a lot of things could go wrong. And I think this Grace is also giving subcutaneous medication, but I saw her give the IV medication in the forearm, on the forearm of the patient, like in the brachial area. She did not give it where we usually give it, which is the dorsal part of the upper, no, forearm, upper arm brachial. That's where I saw her give the medication. I don't think that's her account anymore. Okay. There's two Facebook accounts. Okay. You might think like, is there really a reason for me to be this concerned or angry with Grace and MG? And yeah, one of them is, here's the thing: the public doesn't really know who is taking care of them in the hospital. It's either two, a doctor or a nurse. All else will fall into those two categories. A lab tech comes in, some people think that's the nurse. Or a janitor comes in, and some people think it's a doctor because of the scrub suit. So it's gonna fall into two things. And if somebody looks at Grace, they will think that she is a registered nurse. But a lot of the things she is doing is very dangerous and can leave a negative impression on a lot of people. There has been several posts or news or incidents in the past wherein somebody got angry at a healthcare worker or a hospital staff, and they immediately blamed it as nurse, where in fact I actually knew that it was someone else, like a nursing assistant or an IW, or what we call institutional worker, or basically a wardman, or even like a driver. So there was like several incidents, but they always blame the nurse, right? This time we have somebody who is pretending to be a nurse. I was contemplating if I should play the music for this one, but I think the music brings into perspective on what she is doing. And I think this is one of the few videos, or like many videos actually, one of the many videos that could be used to like really investigate Grace here. But this one is a bit more. Aside from the fact that she is already committing crimes, giving IV medications, subcutaneous medications without the proper license, this one is a bit different. And I'm not just one of the people who says it is, because this person here who reposted it in the Philippine Caregivers Nation, showing that this what Grace is doing is very bad. And I'm gonna play the video once, and we're gonna talk about it. And there we go. I'm gonna have to leave the sound on this one. Okay, so did you see what she did there? She was basically assaulting the patient. And I say assaulting because there isn't like a physical contact directly to the patient, but she is using the back of the chair to hit the patient. And you can see the patient react. I don't know if this is a male or a female. You can see the patient reacting, and they were slapping their thigh. I don't think it is in laughter. I think it is in distress. The patient is hitting their thigh in distress. Let's take a look at it another time. Another time. One more time. See that part over there. That seems to be a patient in distress. So that's the thing that I'm talking about. Like, again, Social media is really not good for the healthcare industry. Do not post anything about the patient. Do not post the patient. And if you are going to be making a post, it should be done with great care, that you do not divulge the identity of the patient. You do not give out enough information for the patient to be identified. Like, if you are going to do a case study style, make sure that it is explicitly mentioned in your video that it is only for educational purposes. And even with all of those difficulties that you're going to do with a social media post, it's better not to. The risks and the cost are too high for you to like do it. And you just happen to be also not a nurse. You're not even a certified caregiver. uh there is a bit of a gray line talking about caregiver, because anybody can hire a caregiver, anybody can claim that they are a caregiver. You are just basically hiring a person just to take care of a patient, and really, it's fine. Right now, I have a cousin with no medical degree taking care of my grandmother, and it's fine, okay. But the problem with Grace is that, one, she claimed to be a nurse, for her to be given orders to give subcutaneous deep suctioning and IV and irrigation and everything else. Second, she also claimed to be TESDA accredited. And those two things is what makes the situation bad for her, because it's fraud. And just don't post anything. This could maybe it's a blessing in disguise that this is something that she was too prideful to do, that her post actually brought her down. Yeah. At the end of the day, everything we're doing is for our patients. That's the oath that we took when when we became healthcare workers. I suppose that as caregivers, that should be the oath that you should be taking care of also, because your name is there. Caregivers, not elderly sitters. Yes, I'm just joking, guys. I'm just joking. Have a good night, everyone, and God bless.